For the better part of a decade, Jones Day has worked with Heal Trafficking and the American Hospital Association's Hospitals Against Violence initiative to combat the horrific scourge of human trafficking. From the very beginning, Mindy Hatton, AHA's outgoing general counsel, was instrumental in organizing, deploying, and ensuring the success of this partnership. Recently, Mindy talked with Jones Day partner Bethany Biesenthal and reflected on how the AHA became involved in the fight against human trafficking and the importance of training the healthcare workers so vital on the front line of this critical effort.
Mindy, thank you so much for joining us today at Jones Day. This is a bittersweet conversation because you have announced your retirement from the American Hospitals Association. So because of that, we wanted to take the opportunity to talk to you about your amazing career and specifically the anti-trafficking work that you've done on behalf of AHA. So can you start off by telling us what your role is at AHA and how long you've been there?
I can, but first of all, let me thank you for the opportunity to talk about this and for the years that we've been partners with Jones Day on this effort. And I know we'll talk a little bit more about that during the interview. It's been our pleasure and our privilege to be able to work with you and your colleagues over 7 years or more, it seems longer, on this important issue. I came to my legal career a little bit late. After being a psychology major and then trying public administration, I realized it wasn't what I wanted to do. And so I actually enrolled in law school at night thinking that it would just be, I'd go do something else, but it would be terrific to have a law degree on my resume. And I fell in love with law school, which I know is a character defect, but I completely loved law school. I loved everything. I really loved everything about it. And was really fortunate to have a couple of opportunities to work with firms, had both interesting work but also a commitment to pro bono work. It really made a difference. I could see how both law could be an intellectually interesting career but also a fulfilling career because you'd have the opportunity to do some meaningful pro bono work.
So had you always focused on healthcare?
Some of the work that I did before and while I was in law school was with healthcare organizations. I worked for the Association of American Medical Colleges for a while doing some legislative work, and then for a couple of other organizations doing legislative work in the healthcare field, including when I was clerking. When I clerked at a firm that represented a group called the Coalition for Healthcare Funding and was very involved in the work that they did, which was mainly around funding for NIH research. And that got me interested in healthcare. And then when I had further on in my career, I became an antitrust lawyer, and healthcare was a very big issue. And so I started working with a lot of healthcare clients on antitrust issues and loved both of those fields. And even when I went to the Senate, working as the antitrust counsel for the Antitrust Senate Antitrust Subcommittee, there were a lot of healthcare issues that I worked on. So healthcare is, since I started my legal career, or even before I started my legal career, there was a real background and a real interest in healthcare.
So what eventually led you to AHA, American Hospitals Association?
I was very happily pursuing my legal career and had done well and then was working on a lot of interesting projects. But my boss now and I had gone to graduate school together. And at that point, AHA didn't have any lawyers or any legal operation. And so I was sitting happily at my desk one day when he called up and made me an offer that I have capsulized into, how would you like to make less money and have more fun?
How could you say no?
Really, come work at the American Hospital Association. And yes, it was the more fun that got me because I did make less money. But the opportunity to work in the hospital field and as a lawyer, and then to work with institutions that I had the utmost respect for, and to represent those as my clients every day was a real draw. And so I took the job.
So you're the general counsel. Were you the general counsel from the beginning of your time at AHA?
I was not. I was the chief Washington counsel. But we really had no lawyers, so to speak. There was one lawyer in our Chicago office that mainly reviewed contracts, so we had no lawyer to speak. So I practically functioned as the general counsel on a day-to-day basis. But no, I started off with the chief Washington counsel. That was a nice melding of both my training as a lawyer with with several national firms, but also the time I spent in the Senate, actually working with lobbyists and legislation and how all of that came together. And it's been very useful in my career at AHA.
So you eventually became general counsel. Tell us what a general counsel does. You're the boss, right?
Everything and more. So not only are you in charge of all the business functions and legal operations, but among the great things about AHA is that you also are in charge of impact litigation and working on policy issues and legislative issues that have national significance. As we built up confidence among the AHA leadership in the ability of the lawyers to really make a difference, we really began participating in a lot of high-impact national litigation. We participated, for example, and we organized the whole field to supply amicus briefs in all the Affordable Care Act cases, which were so consequential to the healthcare field, and fortunately we prevailed in every single one of them.
Amazing. So many projects that you should be so proud of and that we've all been proud to watch you accomplish over the course of your career. One maybe, at least to me, stands out more than any of the others, and that's your work in anti-trafficking. So I know from working with you that anti-trafficking work is one of your passions. So how did that evolve?
I'm so glad you asked. It's one of my favorite subjects to talk about. One of our board members, Jim Leonard, who is the chief executive officer at Carle Clinic, was really struck by a couple of violent incidents of mass violence that took place in Florida and then in Dallas. And he came to the board, this is about 10 years ago, and really challenged the AHA board to get involved in trying to do something about violence in our communities that certainly was affecting hospitals and all the staff that works at hospitals, but was really endemic in our society. And hospitals are such important institutions in the communities where you find them, that he was convinced that if hospitals got involved in trying to help stem the onslaught of violence, that we could make a really big difference. And as the association that represents virtually all of the hospitals in the country, we had the opportunity to lead and educate. And so he challenged the board to do that. The board took up the challenge, and I was asked to develop our program, which we called Hospitals Against Violence. We really started from scratch, looking at the issues around violence that were most impactful for hospitals and where we thought we could make a difference. And trafficking was high on our list for a couple of reasons. One, it's a problem that comes to hospitals. Hospitals don't need to go to the community to find it. Victims of trafficking need the healthcare system at some point in their life of being trafficked. But also it was one of your former partners, who was our outside labor counsel at the time, Kurt Kirshner. And he had started and developed a whole team at Jones Day that had this issue as a major effort on the part of the firm, again, to see where you could make a difference. And so it was Kurt helped take an idea that we had and really bring it to fruition and make a huge difference. And we've been partners with Jones Day ever since.
With your work with Kurt and originally with Jones Day, there was a three-way partnership that was formed during the course of that work between Jones Day, AHA, and HEAL Trafficking. Can you talk a little bit about HEAL Trafficking and that three-way partnership, the trifecta? So what exactly is the trifecta?
Well, the trifecta is the American Hospital Association, Jones Day, and HEAL Trafficking. And the way we got together was really, I think, around that convening in Houston that Jones Day organized. HEAL was there, we were there, some of our members were there, obviously Jones Day was there because you organized it. And I think we saw in each other the opportunity, particularly around healthcare, because Jones Day has an amazing healthcare practice in all areas of healthcare, an opportunity to work together because we all brought something valuable and important but different. AHA, we represent virtually every hospital in the country, so we could bring access and experience and a wide array of representatives from hospitals to work on this issue. Jones Day had Kurt Kirshner in particular had been working on this issue along with Taylor in your New York office for years around some of the legal and policy issues, and we're very experienced in that. And of course, Trafficking, which is an organization that was started by a wonderful woman by the name of Hani Soklosa, who was, during the day she was a doctor, and at night she was organizing this international effort to bring together experts on how to identify and how to combat and how to deal with human trafficking, and mostly, I think, how to help survivors. And so I think we saw in the three of us different but complementary abilities to coalesce to try to make a difference in this issue. Part of it was the personalities, but it just worked. We've been working together for 6 or 7 years. The amount we've been able to accomplish has really been accelerated by the partnership, and the respect that we have for Jones Day and HEAL and each other, I think, is really enormous. I can see this partnership going on for years and years because it's been so effective. It's terrific to work with Jones Day. We've had such a wonderful experience. We've had a wonderful experience with HEAL. And again, we all bring things to this effort that can really help make a difference.
So, and we'll talk about that work, I think, in a little bit more detail in a bit. But why is it that hospitals and healthcare systems are in a unique position to combat human trafficking?
I think it's because it comes to them. It comes to their doors. If you look at the statistics, victims of human trafficking at some point, again, in their life of being trafficked, intersect with a healthcare system. It's a hospital, it's a clinic, it's someplace. So the issue is right there in front of us. I think the challenge for hospitals has been to recognize it and then to know what to do about it. Frankly, it's a problem you don't think we should have anymore. It seems like an artifact of a different time, but the sad fact is that it's rampant, and it's rampant in places that you wouldn't expect at all. So the challenge for hospitals is not seeking out human trafficking; it's knowing when it's at their doorstep and what they can do to help.
So you used the word recognizing or recognition or identifying, and we've talked a lot and worked over the years on training for clinicians to identify human trafficking. Why is that important, and why was that one of your passion projects within the Hospitals Against Violence?
Again, because it's not something as a healthcare professional, and particularly nurses, we always find that our nurses are really on the forefront of these kinds of efforts, and they're probably the ones that that interact and intersect most often with victims. And it's not something you learn in nursing school. It's not something you expect. So being able to train them to see and recognize the signs that somebody's being trafficking and then how to deal with it. I mean, you certainly don't want somebody saying in front of a trafficker, "Are you being trafficked?" I mean, that's just the wrong approach. As a health professional, where you see something's wrong or you suspect something's wrong, what do you do? What's the next step to take to try to help the person being trafficked? And we've been really fortunate because HEAL developed a training resource that a number of our members have used very successfully. We've also been able to partner with its administration, and even the last administration, with the Office of Trafficking in Person, that also has a program that is available to all our members called SOAR that helps them do just that, recognize and know what to do when they encounter a victim of human trafficking. And that's one of the things that we've been able to do through this partnership, is to bring people together, to introduce them to the tools, and then to have those that have successfully used the tools spread the word among others that they're effective and they're useful and they can really make a difference.
So there's a training that was put together in a 50-state survey, and then, as you mentioned, it's AHA who has access to the hospitals and the healthcare system. So what has AHA done to ensure access to those tools and resources to the various hospitals and healthcare systems?
We are very close to our members, and we're able to bring them together in multiple ways. And one of the things we've done with Jones Day and HEAL, and we've done a number of them, and actually we started in this very office we're talking in, is we've started convenings where in the beginning we brought the people that we could find that were initially involved in it. And some of those, Colleen Scanlon, for example, who was with Catholic Health Initiatives, which is now part of Common Spirit, a number of other leaders, particularly from Catholic hospitals. We brought them together with others who are interested in this, and started to spread the word and started to think together as a much larger community about how we could work with each other, how we could share our learnings with each other, how we could use these tools, not only within the systems they worked in, but also spread it to other systems to bring them into the fold to help widen the number of groups and the number of hospitals who are not only invested in this, but knew how to do it.
I know that it's been important to you, in particular, during the course of the work of the three-way partnership, that we be mindful of the survivor's voice. So how is it that the three-way partnership and AHA have incorporated the survivor's voice into their work?
I think at every one of these convenings, we've had survivors. And Common Spirit, for example, what's now Common Spirit, the woman who heads their work on human trafficking is a survivor, so she sort of has a dual role. But at every convening that we've done, we've made sure that we've had a survivor voice and somebody to talk to us about sort of the realities. I think that helps keep us grounded in what it's really like to be a survivor. And as we think about these trainings and these tools, are they really impacting the survivors in the way that we hope it will? Helping them feel safe, giving them alternatives and other ways to break free from an unimaginably difficult situation.
So in recent years, I think there was the training and toolkit and 50-state survey, and then the focus more recently has shifted to raising awareness about forced labor within supply chains. And we've talked about this together in front of compliance professionals and others, and I know that you are passionate about the importance of raising awareness on this issue. So why is it that forced labor within supply chains is important, specific to hospitals and healthcare systems?
We've begun to realize this during the pandemic. The whole issue of supply chains, particularly in healthcare, became such a huge issue, and there was so much scrutiny on supply chains. I think it became obvious that there were some places in the supply chain where there was forced labor going on. While those were oftentimes essential medical equipment, the fact that they were being produced from forced labor was just not something that the healthcare field, particularly the hospital field, could ever feel comfortable about. It was also begun to be a focus of the administration to look deeply into some of these issues. And again, Jones Day and HEAL both were on top of the issue, recognizing some of the legal and liability issues around this kind of forced labor in the supply chain. We're also fortunate at AHA. We're a pretty big family, and we have a whole group that's dedicated to materials management, in other words, the supply chain. And through the great work of Laura Castellanos, who I'll talk about more at some point in this interview, she was able to convince them to join us so that we could take all the learnings, we could take all the information and our concerns about this, and we could bring it in and talk to the folks, the people in the hospital who were really in charge of the supply chain. So you're not just talking to the CEOs for whom supply chain can be a somewhat peripheral issue, but the people who have to deal with it every day. And so we did a convening that Jones Day organized and at your beautiful New York offices. They actually came and presented. We'd had Jones Day and we've had HEAL, as well as the administration presented their conferences too. So it's just another way to sort of get the information and awareness to the people who can make the most use of it and can make a difference. So sometimes it's good to have a big family.
Mm-hmm. So speaking of Laura,
yes.
Who at AHA has helped support your mission and vision?
Well, to start at the beginning, Laura came to us as a fellow right as the impetus for developing a program for hospitals to take a leading position in violence, just as it was coming together. And so I think that the recent term I've heard, she was sort of voluntold that this would be her issue, which was really fortunate for us, and I hope it's been fortunate for her, because she had a real passion for this issue and a real facility, not only being able to sort of get her arms around an issue, but find the other partners to work with and to interface with other partners. To bring our colleagues in, we have a whole group at the American Hospital Association who works on various aspects of this. And she really has been the heart and soul of this since we started. And fortunately, she's still with us and still doing it and still doing strategy and planning and outreach every day. And she really has become the face of this work, which is really fortunate because, again, she is so good at finding and working with partners in this field that we've been blessed to be able to spread and accelerate our work in ways that I think we never imagined when we started.
You said it's a big family, and I agree with that. And you talked about work that AHA has done with the administration and the Office on Trafficking in Persons and AHA's members. Can you talk specifically about work that AHA has done with Common Spirit?
Common Spirit is an amalgam of two Catholic hospital systems that came together probably about 5 years ago, Catholic Health Initiatives and then Dignity. And both of them had extremely strong anti-trafficking programs before they got together. As I said, the head of Dignity's anti-trafficking program was actually a survivor. Colleen Scanlon and Laura Krause, who worked at Catholic Health Initiatives, were absolutely instrumental in a number of important efforts, none more important than helping us along with Dr. Wendy Konstantinopoulos from Partners, now Mass General, in finally getting an ICD-10 codes or ICD-10 codes around human trafficking. They've been instrumental in that work, and I'll talk a little bit more about why that work's so important, but also in investing others in really providing a roadmap, I think, for others to invest in those kind of programs to help them understand how to set up those programs and how to be effective. But the ICD-10 code, so when we started this work, one of the reasons we started is because the victims of human trafficking ultimately come to us, come to hospitals at some point. But nobody ever counted them. There was no way to count them. We certainly had a lot of anecdotal evidence, but no numbers. And, in Washington, if you can't count it, does it really exist? And we worked with one of our colleagues, Nellie Leon Chisane, who was a whiz at this obscure enterprise called ICD-10 codes, which are absolutely essential in the healthcare field for being able to identify and count procedures or count the things you're trying to count about what throughput for hospitals. And Colleen Scanlon and Dr. Wendy Konstantinopoulos worked with us to develop the argument and also provide some real world experience. And then Nellie was able to negotiate a very complex process. They're required to get an ICD-10 codes, and we were successful working together. We were successful. So Common Spirit, what's Common Spirit now, has been a leader for years in this issue and has made enormous amount of contributions, but I think none more in the long term consequential than helping us be able to identify and really categorize and count and get our arms around how big is this problem and how many resources should we be investing in it given its size and scope.
So what do you view as the biggest challenges that are still left, hurdles for hospitals and healthcare systems in detecting or combating human trafficking?
I think that the challenge for hospitals is always there's so much to do. And as I mentioned before, they're anchors in their community, and there's so much expected of them. So I think the challenge is keeping this as a priority for them. So many other day-to-day things and issues can become priorities. One of the ways that we hope to continue to meet that challenge is with another part of our family that has been absolutely instrumental, and that's the Association of Nurse Leadership, which is part of the AHA family. And we've continued to work with that organization and that group of nurses. We found again and again that nurses continue to be on the front lines of this issue. And if you can keep them excited and invested in this, then you can continue to accelerate your work, to build on your work, to think about what the next iteration of the work could be that could make a difference. They're an absolutely essential partner, and we're so happy that we've been able to work with them, and they've been so invested in this. And the head of that organization, Robin Begley, is actually on our executive team, and along with Megan Schaefer, who's taking my place, who is our Vice President of Governance, who can continue to excite both the AHA and the nurses group and keep them invested in this really important work.
So the work will continue.
Absolutely.
So we know you're retiring, but what's next?
What's next for the work? Your colleagues, along with Laura Castellanos and Megan Schaefer and Robin Begley, will certainly chart a future course because there's always work to do. One of the ways that Jones Day really got us invested, and again, I give Kurt Kirshner full credit for this, was a convening that Jones Day put together in Houston. I think it was 6 or 7 years ago. It was right after the Super Bowl in Houston. Super Bowls, it turns out, are magnets for human trafficking. And Jones Day put together this incredible convening that included healthcare, representatives from hospitals, and I was invited from healthcare associations, but also the transportation industry, the hotel industry, state and federal government, and other parts of the economy that find themselves needing to deal with human trafficking concerns. And it was a really wonderful conversation that I think helped spark all of our thinking about how we could in each one of our sectors do more, but also how we could intersect and work with other sectors to accelerate those efforts. One of the thoughts has been, because one of the biggest sporting events in the world will be taking place in the United States in just a few years, the World Cup, that would be a wonderful opportunity to maybe not do a convening, but maybe some regional convenings, bring together that sort of amalgamation of people and interests and industries and fields, and reignite and re-energize the efforts and rededicate ourselves to continuing this work and also finding new ways to expand it and improve it.
So I was thrilled today to learn that you're staying on as a member of the Advisory Council. So this is not a goodbye for you to this work. But because you are retiring, we wanted you to know that we will miss you very much on behalf of Jones Day and HEAL and AHA. And we're extremely proud to have worked alongside you. You're a champion of this movement, and congratulations on your retirement.
Well, thank you. And believe me, we feel exactly the same way about Jones Day. It has been a privilege and a pleasure to work with you. And our tripartite group, along with HEAL, has been such a blessing. Given our different interests and what we bring to it, it has really been a wonderful partnership. And I think most important, I think it's a partnership that's made an impact. I think we can see the results of that and feel proud of them. So thank you and your colleagues. There are lots and lots of colleagues at Jones Day that work with you on this every day, and we are enormously grateful. So thank you for partnering with us. Thank you for bringing us into the fold in the first place and really letting us support you and you supporting us, and again, making a difference in such an important issue that we don't see an end to yet.
Mindy, thank you very much.
Thank you.